COVID-19 response using NHIS Big Data. Hello, this is Dong-Wook Kim, Senior Research Fellow of Big Data Department in National Health Insurance Service. Today, I'm going to explain the big data system of the National Health Insurance Service, or NHIS, how we've built the system, and which services we've developed and are providing using the NHIS's big data. The lecture will mainly focus on big data used in healthcare field. We will look at overview of big data, including concept, purpose, the process to collect, etc. In addition, this lecture will cover what kinds of the big data accumulated in NHIS and how Korean government utilizes NHIS big data for COVID-19 response. I would like to talk about 4 issues. First, I'll introduce the big data system of the National Health Insurance Service, NHIS. Second, I'll explain the National Health Information Database, in short, NHID. The NHID is a database built from NHIS data by the Big Data Department to provide information for research and public services. Third, we prepared NHID big data that was used to overcome COVID-19. And lastly, I'll present the wrap-up. The course is designed to learn the concept of big data in healthcare and how to collect data, build understanding of what kinds of big data used in healthcare, and share how Korea utilized big data to respond to COVID-19. The first topic is an introduction to the NHIS's big data. Before the lecture starts, let's think of the definition of big data. How big is the data? And how could we use this valuable data for a better purpose? Big data means that it is a large volume of high-velocity, complex, and variable data that require advanced techniques and technologies to enable the capture, storage, distribution, management, and analysis of the information. According to this definition, NHIS data is clearly big data in terms of its volume and characteristics. Next, what is the meaning of big data in healthcare? Big data has the potential to improve care, save lives, and lower costs by discovering associations and understanding patterns and trends. For this reason, the primary purpose of using the NHIS big data is finding meaningful results from the collected materials to prevent and manage diseases, expand healthcare coverages, and establish cost-effective healthcare policies. In short, to achieve the goal of the NHIS, improving people's health and quality of life. Now, let me tell you about the background of our health insurance big data. First, the National Health Insurance Service, as a single insurer, manages all people's eligibility and all healthcare premiums in Korea. Second, healthcare providers have to register with the National Healthcare System and claim for reimbursement. Third, as our main payment system is based on fee-for-service, the claims data contains every detail of each treatment and medicine. Fourth, the NHIS operates a medical checkup for all people regularly. And last, and most importantly, all this data is claims data that organizations have collected about their operations. Therefore, it is not only highly accurate, but also there is no additional process or costs needed to collect nationwide big data. Thanks to the characteristics of Korea's health insurance system, we are able to secure the big data of the NHIS. I'll elaborate on the NHIS's working process. 1. The NHIS imposes premiums and manages beneficiary eligibility from birth to death. 2. When the insured visits medical institutions and receives treatment, after the treatment, the medical institution requests for reimbursement. 3. The Health Insurance Review and Assessment Service, in short HIRA, screens the claims data. After they finish the review and assessment, they send the data to the insurer so that the NHIS can reimburse the fees. All data generated in each process is computerized and electronically interchanged. This slide shows data collection and connection with other organizations. Data on health screening and long-term care is generated when the NHIS performs its work. Furthermore, the administrative data of various related organizations, such as the Ministry of Health and Welfare, National Tax Service, Ministry of Justice, the Ministry of Defense, and so on, is linked to manage beneficiary eligibility and premiums of the entire nation. This slide shows the process of building the NHID. NHIS data from each work process is computerized through the Electronic Data Interchange System. Every day, all of the data is accumulated on the data warehouse system. Via the DW system, NHIS data is refined, cleaned, and reconstructed to form the Korean National Health Information Database, NHID in short. All information is de-identified and restructured to include all cleaned main variables. Now, I'd like to introduce the National Health Information Database, NHID, in detail. The eligibility database is the most important database. This eligibility database is generated by linking 36 organizations to identify socioeconomic information. This database not only includes gender, residence, birth and death, family and disability registration information, but also income information, including pension and assets, which are necessary to calculating premiums. This is the Medical Service Utilization Database. Medical utilization information is collected from the institution for reimbursement. It has medical information, such as the day of the visit, disease code, medical procedure, prescribed medicine, and cost. Additionally, the medical institution database contains the address, workforce, facilities, and equipment of each medical institution. This is the Health Screening Database. This database is about the regular medical checkups for the entire nation. It contains the health behavior data from questionnaires, biomedical figures, and health screening results. Through the Health Screening Database, we can check various risk factors, such as smoking, drinking, blood pressure, and blood sugar, which are key factors in predicting disease incidence. This is the Long-Term Care Database. This database is based on long-term care insurance services, which provide home care or nursing home care for the elderly, who have difficulty taking care of themselves due to old age or geriatric diseases. It contains data of long-term care grade after assessment, long-term care services, and information on long-term care facilities. Why do we use big data for COVID-19 response? In February 2020, COVID-19 confirmed patients increased explosively due to mass infection in Daegu, Gyeongbuk area. In order to manage hospital beds efficiently, the medical institution utilized NHIS Big Data by classifying the patients based on severity and decided hospitalization priority. In addition, a research found that COVID-19 death rate might be related to whether to have underlying disease. NHIS Big Data held all citizens' disease history so that it helped check the patients had underlying disease or not. Korea and all countries across the globe faced the financial crisis since the outbreak of COVID-19. Each country decided to allocate disaster relief funds to citizens to stabilize its economy. However, there were many difficulties in deciding the recipients and amount of funds to be allocated. As for the U.S., the country decided to pay each adult up to $1,200, and the amount of money allocated differed according to the income level. For instance, the federal government provided the package by subtracting for every additional $100 of income for those whose annual income was in the $75,000 to $99,000 bracket. Also, those who earned more than $99,000 were excluded from the eligible recipients, and those aged under 17 was given $500. Hong Kong provided a cash handout of 10,000 Hong Kong dollars to each permanent resident who were aged 18 or above and lived in Hong Kong for over 7 years. And Taiwan allocated 40.4 billion Taiwanese dollars as vouchers to companies and their employees affected by the disease. Singapore provided up to 300 Singapore dollars in cash to its citizens aged 21 or above according to their income and assets, and gave an additional $100 to parents with children aged under 20. Let me explain you about how Korea decided to provide emergency relief funds in detail. First, we determined to provide up to 1 million Korean won for 4-person households in the bottom 70% income bracket as emergency relief funds. We used health insurance premiums as a standard to identify their income. As for office workers, all health insurance premiums of family members were combined to calculate the allowance. For instance, they were eligible to receive the fund if the total amount of premiums was less than 88,344 won for a single-person household, and 150,025, 195,200, and 237,654 won for 2, 3, 4-person households, respectively. For local medical insurance holders, including the self-employed or others, we applied different standards for each family member, such as 63,778 won for a single-person household, etc. Such approach based on health insurance premiums was not used in the end, as the government changed its stance to allocate the emergency relief funds to all citizens. However, the government was able to make prompt decisions in the first place, as we provided a sufficient amount of NHIS Big Data to be used as the basic material. We consider that wearing a face mask is a must to stop the spread of COVID-19. We operated a 5-day rotation face mask distribution system to provide equal opportunities to all citizens, and HIDA modified its existing claim system to support pharmacies to check the eligibility of recipients easily to establish such system. It also provided the information required to develop applications to check the remaining quantity of face masks to support the operation of distribution system, bringing substantial benefits to the public. In the meantime, we use the big data for prompt admission and release of COVID-19 patients by classifying them with severity. NHIS retains the data of hospital visits amassed since 2002, and which allows us to track their history of disease for the past 10 years or over. Such data provides more precise information on their health state without any faults than their memory, and helps to identify the status of patients clearly. Medical examination conducted each year or in every 2 years helps an individual to identify their health state, and investigation of individual lifestyle habits allows us to detect the history of smoking in order to find out any connections with COVID-19 or measure the severity of risk. The NHIS Big Data was useful to provide guidelines on classification of COVID-19 patients by severity, which was considered as a proper measure to prevent the shortage of hospital beds due to the admission of people confirmed with the disease in initial stage, leading to the deaths of patients with severe symptoms. Also, it provided a critical information to support the government to establish guidelines on making prompt decisions upon national disaster. In addition, we linked the data compiled after epidemiological investigation and ones obtained from health screening to analyze the big data in order to determine the severity of risky factors to COVID-19 patients and identify those vulnerable to the infection among ordinary citizens. Based on the result of the analysis, we were able to identify the relationship between lifestyle habits, obesity, exercise, smoking, etc., and COVID-19, and the risk relationship between certain age groups and underlying diseases, contributing to providing the information on the risk of infection to those belonging to such groups. We use the claims for reimbursement of medical treatments such as oxygen therapy, ECMO, etc. for COVID-19 patients with severe symptoms to support healthcare providers to analyze the relationship with regard to how the history of medical treatment and diagnosis were used to treat such patients, and what kind of medical treatments were carried out. The accumulated data was not used to support the government policy only. Efforts by agencies holding big data were made to provide an equal opportunity to external researchers as well. For instance, Health Insurance Review and Assessment Service, HIDA, became the first of its kind to disclose its data to global researchers in CDM files and provided separate analytical tools to domestic researchers to support their study. NHIS disclosed the data that compared confirmed cases with those without the disease so that researchers could analyze the severity of COVID-19 from a different angle. Lastly, we identified the status of COVID-19 in Korea, available human resources and equipment in medical institutions in preparation for a second wave of COVID-19. Also, we examined changes in the healthcare system after the outbreak of COVID-19 and provided the basic data on medical treatments that were difficult to be provided due to the risk of infection and how to manage and treat patients with chronic diseases in need of constant care. Now it's time to wrap up the lecture. Regarding the big data in healthcare area, utilization of data in time is equally important as the accumulation of data. Although Korea has accumulated personal data relatively well, there are certain limitations on using such data to conduct a research to identify the cause of problem due to data sensitivity. Hence, we need a legal safety net to use such data to solve problems upon national disaster. It should be used proactively, only to resolve national issues of grave importance, and the data user should be extremely careful to prevent the violation of data privacy. In addition, it needs to provide the data to solve a problem with multi-pronged approaches. If we provide the data to certain researchers or organizations only, they may interpret the result of analysis with a biased view. Therefore, provision of data should be made in a way that may lead to the development of various approaches to solve the problem. Thanks for listening.